My name is Dr. Sandra Cremers. I'm one of the surgeons here at Visionary Eye Doctors, and I'm also at Suburban Hospital. So dry eye is basically a condition that involves an abnormality of the tear film. The tear film has three parts: the oil, which comes from these glands called the Meibomian Glands, the water, which comes from a gland here called the lacrimal gland, and the thing that mixes it together called the mucin, which is on the white part of the eye. So dry eye is an abnormality of one of those parts, usually a combination of them, that makes the tear film unstable. And when the tear film is unstable, it can feel like you're not even blinking. And if anyone doesn't blink, they'll be in misery. The dry eye symptoms, the most common symptom is actually you feel like your eye is kind of dry. You might feel a foreign body sensation. You can have like itching, burning, reflex tearing, pain. Those are the key things. Redness. Some people don't even realize they have dry eye. They'll just see a little bit of redness from time to time. There are many treatments for dry eye, and it can be very overwhelming. There are two key paths of dry eye. The most important is to save a gland called the Meibomian Gland. So the second path is to help with the symptoms. And that's super important because people come in because of their symptoms, but the treatment for the symptoms does not always equal saving these Meibomian glands that produce the oil. But they're equally as important. And there's a whole toolbox of options. And the toolbox, again, is on this sheet. These are still all the treatments in the world for the symptom relief. And so we work as a team with the patient to kind of use what tools work for them today versus next year versus in 10 years. And of course this toolbox will change over the years, but this is the key ones that we do recommend. Some patients are allergic to certain medications or tools, and some patients love certain ones and hate certain ones. Some insurances cover certain ones and so forth. So we work together to see what a patient needs initially. So the key tools are basically, the first is the warm compress routine, which helps with symptoms and it saves the Meibomian glands. The second is about diet and natural options, which is a huge factor. Things like doing exercise, aerobic fitness, eating well, eating green leafy vegetables, antioxidants, trying to go low carb, decrease your gluten and sugar, increase your omega-3, drinking a lot of water, humidifier, HEPA filter, Xena dry eye goggles. These are all these very natural options that some patients find very helpful, but there's no randomized controlled prospective studies in this. So it can be frustrating to see which one's the best, but there's a whole bunch of natural options that we go through. And then the third option is non-preserved artificial tears that anyone can get over the counter. They come in these tiny little vials. We usually let patients reuse them as long as they're not touching the tip, and they can be kept in the refrigerator, which helps with symptoms as well. So those are the first three steps of the treatment ladder, which help most patients in terms of the natural options.